Welcome back to Mornings on this Monday. Well, not everyone loves the nose they were born with or the nose that perhaps life inflicted upon them. In cosmetic surgery procedures, rhinoplasty is the third most popular procedure after liposuction and breast surgery. To tell us more, facial plastic surgeon Dr Michael Zacharia and his patient Sharron. Good morning, one and all.
Good morning.
Rhinoplasty, that's a nose job.
That's right, Kerri.
It's a very unfortunate name, isn't it, rhinoplasty?
Every time you hear rhinoplasty or rhino, you think of a rhinoceros, which has a big nose, of course, so it is an unfortunate term.
A very, very unfortunate term. Many people these days, as I said, third most popular procedure. What are the reasons people, that we know the obvious, but what are the reasons that people are actually having plastic surgery on their nose?
I think rhinoplasty itself, or a nose job, is generally a procedure that people have done because they are born with a big nose or born with a big bump, or it's slightly crooked, or sometimes after trauma as well, patients will want to change themselves back to where they were. And
very often breathing difficulties?
Absolutely. A lot of people have breathing difficulties, so you can change the function and the look of the nose at the same time.
Now, Sharron, you are going to undergo this procedure Monday week, I understand.
Yep, that's right.
Why?
I have breathing difficulties. I broke my nose a number of years ago and have a lot of trouble breathing out of the left side. So I have to get that fixed, and I thought if I'm going to get that fixed, I may as well get a new nose. I never really liked it, so...
You didn't like it?
No, not the side profile. I never sort of... It didn't bother me dramatically, but if I'm going to go through surgery to get it fixed from the breathing side, I may as well get a new nose at the same time.
Well, what are the choices in noses these days? Because we've got some before shots. No, because when somebody wants to have their nose changed for whatever reason, you can actually do it by computer and give them examples, can you not?
That's right.
OK, we've got a photograph of Sharron's nose. Now, this is obviously the front. Will it change in... what will you attempt to do? Or what will you do, rather?
Well, in Sharron's case, I'll be reducing the tip is slightly bulbous, so slightly rounded, so we're going to reduce that a bit, deproject it so it's not actually pushing out so far from the face.
And the one clearly on the right is the desired effect. And, OK, clearly it's a bit smaller, a bit... Is that basically?
Yes, it's smaller, the bump has gone, and also the tip is just slightly turned up a little bit.
Is that a fashion thing?
I think, yes. In females, we like to have the tip up, raised around about 95 degrees. So a fashion thing to have a slightly turned up tip.
A turned up nose. How are you feeling about that?
As long as it's not too turned up, it should be OK.
Are you anxious about this?
I am a little bit, yeah. But I'm really excited. Now that I've decided to get it done, I can't wait. I just can't wait for it to be done.
OK. In the operation, how do you achieve this?
There are two ways of actually...
I'm sure Sharron doesn't actually want to know the answer to this question, but so it is traumatic, isn't it?
Oh, quite traumatic. In my case, I do most of my surgery through incisions on the inside of the nose, but there is a way of doing it where you make an incision on the outside of the nose to expose all the cartilage and bone. So it's a matter of reducing the cartilage and bone, and we use things like... It's bone, so we have to use things like rasps and little chisels and things to lower the bridge of the nose. How
do you not then traumatise the skin on the nose?
Well, that's part of the skill. The nose is quite difficult because everything is hidden underneath the skin. So we actually do everything through little incisions on the inside of the nose.
Wow. And how long will that operation take?
In Sharron's case, it's going to take around about an hour, hour and a half.
Do you actually have to break it?
Yes.
I knew that was the answer.
And we break it with very fine instruments called chisels. But they are very fine.
Or a football boot, I think, apparently does it quite well as well. Yeah. So you actually break the nose, mould the cartilage and the bone to the desired effect, but you do it from the inside.
That's right, yes. And there is a technique where you can actually make an incision under the nose here and lift up the skin completely. But I tend to do it more through the inside. OK,
so the operation is an hour or so. Recovery time?
After the surgery, the patient has a plaster on their nose, and that's usually on for around about a week to 10 days. There's a lot of bruising around the eyes to start with.
Because that's you and your chisel.
Exactly.
You and your chisel did that.
Exactly. And unfortunately, we have to, in most cases, do a bit of chiselling. But fortunately, the swelling is not too bad, and after a week when the plaster comes off, Sharron will have the new shape of her nose. It will swell up a little bit over the next coming weeks, but by around about 2 months, it will be a good example of what it's going to be like in the future.
Wow, and you will join us in 2 months' time, because it must take that long for swelling to in fact subside.
It does,
yeah.
And with all cosmetic surgery, it takes 3 to 6 months for everything to really settle. And in particular with rhinoplasty surgery, I tell the patient that around about 12 to 18 months is when they're going to see their final result, when the feeling really starts coming back to be completely normal.
There are a lot of Hollywood stars, and you know, we see the pictures in the magazines, and you know, not every... Well, Jennifer Aniston, I mean, she came out publicly some time ago. I've got to say, why on earth Jennifer Aniston just recently had a nose job? I don't know. She looked pretty darn fine beforehand. And I think there's some other examples that we've got. I mean, Danny, do you think Danny's had... Well, I mean, it's always hard with different photographs and different ages.
It is, and...
But is the nose the one thing that always stays the same? Doesn't matter whether you get older, fatter, thinner...
It does, and there's no doubt that the cartilage may grow a little bit, or the tissues, they soften, and so you get lengthening of the nose. So the oldest patient I've actually performed the procedure on was a 76-year-old lady.
Wow.
She had wanted to change her nose all her life.
My heavens above, hasn't Celine Dion changed? I think she had her teeth fixed as well.
I think so.
Oh, I hate those before and after shots. They're disgraceful doing that to people. OK, in terms of age, there are probably a lot of teenagers who don't like the look of their nose. At what age is it OK to operate?
Well, the nose continues to grow till around about 18 or 20. Now, I've performed surgery on a young girl, 16, but she came in with her parents, and we sat down, had a discussion about what she wanted to achieve. And I think by the age of 16, most of the growth, especially in a girl, has been completed. OK, and cost here,
what are the rules and regulations with medical benefits and that sort of thing? What are you doing?
Well, because I'm getting my nose fixed for both breathing and also cosmetic, I'm getting some of that back from my private health fund, and then the rest is out of pocket.
So as long as there's a health issue, there's, you know, potentially getting money back.
Exactly. That's usually a matter of the function of the nose with breathing problems.
Well, I think this is something we haven't done on the show, so I think you're very brave, and I'm glad you're excited and really keen to get on with it. We really look forward to seeing you in a couple of months' time. All the very best.
Thank you.
And Dr Michael Zacharia, thank you for your time. Sharron, look forward to catching up with both of you. OK, we've got more coming up on Mornings shortly. The first-hand story, that a terrible toll that war takes on our young people. But after this break, but happier story. This is today is the birthday of the Sydney Harbour Bridge, but it's also the 75th birthday of someone else.
I still call